Today is World AIDS Day, which is a very serious or very critical disease, which is like a pandemic. And from 1988 onwards, the world started creating awareness on this 1st December of every year. They started creating awareness about this. In addition to that, at present, if we look into the various data about this AIDS or HIV, rather I'll call it HIV and AIDS, because HIV is a beginning and AIDS is the result of that. So it's a major public health issue. And at present, 33 million people in the world, they are suffering from this disease. In addition to that, you will be surprised to hear that 38 million people at present are living with HIV AIDS these days. These are the figures for 2019. Another good thing, I'll say it's a good thing, that 81% of these people who are living with AIDS, they are aware of it and they are taking structural, or you can say they are making efforts to try to live with this with different type of treatments, ART treatment, which is quite effective to stop the dissemination of this disease. But nowadays, because COVID is going on, so the problem which is happening nowadays, the treatment for this HIV has got a setback. So the facilities which are to be used for AIDS are very less nowadays, but still we are making certain progress in this area. So there are a lot of data available. If we go to the site of WHO, these are the data from WHO site. So instead of going into the data, let's have a discussion on this topic. We have Dr. Nisha Aggarwal. Let's talk about it, because let's talk from the point of view of a medical professional, as well as the psychological issues, social or psychosocial issues which crop up because of this disease. So Dr. Nisha, I'd like to come to you. If you want to say something, some few lines on this disease, that will be good for all of us.
Thank you, sir. So to start with, it's very strange to know that we started having AIDS or HIV, you can say. The first case we had in 1920. And we started this, basically it was not HIV virus, it was the SIV virus. The basic virus is SIV. It's called simian immunodeficiency virus. And it basically transmits disease in chimpanzees. So when human beings started eating this flesh of chimpanzees in Africa, so then it started coming in humans. And so we named it from SIV to HIV, human immunodeficiency virus. Yeah. And then from Africa, it started spreading to the whole world, different continents. And in 1980, it started become like an epidemic. Mm-hmm. So it's a disease sort of like cancer, because जैसा हम लोगों की society में cancer को लेके एक fear रहता है. Once somebody acquires a cancer, so they start considering themselves, it's of no cure for me now. So something similar happens with a patient of HIV also, which is actually not the situation. So I think in today's discussion, we'll clarify lots of myths and we'll be able to share lots of knowledge about what exactly the truth is.
डॉक्टर निशा, मैं डॉक्टर पिंकी उनसे भी पूछना चाहूँगा, बिकॉज दिस इज डिसीज जिसका कोई क्योर नहीं है जी, इसको कंट्रोल किया जा सकता है, इसको आप एड्रेस कर सकते हैं कुछ हद तक, ताकि ये बढ़े ना, लेकिन इसका क्योर नहीं है। तो मैं डॉक्टर पिंकी आपसे पूछना चाहूँगा कि इट्स ए लाइफ लिमिटिंग, इफ आई एम नॉट रॉन्ग, इट इज़ ए लाइफ लिमिटिंग डिसीज। So इस तरह के केसेस में there are a lot of psychosocial issues which comes up, such as stigma and other related issue also comes up. डॉक्टर पिंकी हमारे साथ है? डॉक्टर पिंकी, हेलो?
Am I audible?
हाँ जी,
Am I
डॉक्टर
audible?
पिंकी,
Yes, I can hear you. Of course,
one is
most importantly, hello?
मैं let me complete my questions.
Please do.
एक तो थोड़ा आप इसके बारे में अगर कुछ कहना चाहें तो वो, दूसरा मैं ये कहना चाहूँगा कि because it's a life limiting disease, so there are a lot of psychosocial issue comes up. Another issue is a stigma also, social stigma. So what do you feel, how it is affecting the society at large?
First of all, I would say that as soon as you have used the word life limiting,
जी.
that itself is a huge fear.
Mhm.
Like if anybody gets cancer, the first thing is that, oh God, शायद वो ज़्यादा दिन नहीं बचेंगे. That is the knowledge which is in people. That is the reason why people immediately loses hope. लाइफ लिमिटिंग है, बट इसको मैनेज करके ऑलमोस्ट आराम से अपनी जिंदगी काफी दिन तक जिया जा सकता है. आई एम श्योर आई एम सेइंग राइट डॉक्टर निशा, करेक्ट? Yeah. So even if anybody is having HIV, AIDS, of course, these two are separate segments. If you have HIV, you may not finally reach the stage of AIDS. So you have all opportunities to, think positively that it may not be as limiting as you think it to be. One. Two, the stigma that you are talking about is basically the cause of this illness. The most known cause of this illness is unprotected sex. So immediately a person starts thinking that individual must have done something wrong, जिसके कारण ही there is a huge fear of even coming and admitting कि शायद मुझे एड्स है. अपने पार्टनर को भी, अपने वाइफ को, अपने हस्बैंड को कई लोग बता नहीं पाते because they are under a fear. And then when they go out in the open to accept it, they are scared that they will not be accepted as a normal human being. So more than life limiting, they get socially limited. They are almost ostracized. They are kind of kept away from people. That is the social fear that this disease has got into the minds of most people. But however it is a virus. Though we have not been able to find a preventive for it as yet, but medical science has done that much of discovery by which even along with this disease, you can have a normal life for quite some time. Therefore, awareness building amongst normal people is extremely important because कोई भी disease अगर आपको पता नहीं है तो आपका इलाज नहीं हो सकता है, आपका वो restrictions and जो भी आपकी preventives है वो नहीं लिया जा सकता है. Therefore, वो बहुत जल्द आपको बीमार करते हैं. Now, in this HIV, most importantly, as Dr. Nisha has pointed out, it is immunodeficiency. Means अगर आपकी immunity कम है तो आप कोई भी illness का शिकार हो सकते हो, कोई भी, सर्दी खांसी से लेके कुछ भी, even cancer. So if anybody has such symptoms, it is extremely important that we understand and reach a specialist to find out and take the test whether you are actually having it or not. To remain in fear से अच्छा है कि इस fear से निकले और इसको accept करें and then work on it.
So Dr. Pinky, let's go to Dr. Nisha, and let's try to find out what type of disease it is, why it is happened. So Dr. Nisha.
Yes, sir. So, sir,
So what is this HIV oblique AIDS, what it is, and are they both similar, or are they one and the same thing, or they are different? So can you explain it to all of us?
Sure, sir. So when we say HIV, we all understand the meaning of HIV. It's a human immunodeficiency virus. Basically, this virus attacks our immunity system. जो हमारे body के cells हैं, जो हमें किसी भी disease से fight करने में help करते हैं, ये उन cells को kill करता है. In other words, if I like to explain in a general language, so it is the virus which basically deteriorates or which decreases our army, which our body has, is the natural defense mechanism. So then the individual becomes prone to get any sort of infection. If you see the people who are suffering from HIV, they never die because of HIV per se. They die because of opportunistic infections, because of cancers, because of associated diseases. So basically, it's a immunity which gets lower down in this case. And most of the time people get confused in HIV and AIDS. So I would like to clarify that HIV is basically a virus. If you have found that virus is in your blood, you are tested positive, then we label you as seropositive, or we call you as HIV positive individual. Now, once this virus is inside our body, it starts killing our cells, which we call as CD4 cells. The main attack, जो उनका main system रहता है attack करने का. So once your virus replicates in such a number that your CD4 count is less than 200 ml per copies per ml of your blood, or you can say is the last stage of your infection, then we label it as acquired immunodeficiency syndrome. As the name itself justifies, it's a syndrome. And syndrome means you have acquired multiple diseases at one time. So if an individual has multiple problems at one time and her immunity is already low, so it becomes a last stage and it becomes very difficult to treat these kind of patients. And then we label them as AIDS patient. But if the HIV patients, they come to know timely, they start taking treatment timely, so this phase of transfer from HIV to AIDS can be prolonged to any number of years. We have patients where they are quite healthy till 20 and 30 years. So it all depends. So awareness is the basic tool to fight with this disease.
And Dr. Nisha, that means HIV का जो result है virus की वजह से जो होता है, that is AIDS.
Right, sir. See, HIV progresses in 3 stages, if I would like to say. First is the acute phase, where a patient can start with some sort of like any viral illness, like flu symptoms, fever, mild cold, cough, or maybe starting diarrhea. So these very vague symptoms where you cannot classify the patient, yes, you are having AIDS, you are having HIV. So it's very vague presentation. So this is acute phase which lasts usually 2 to 3 months. And then this virus keeps on progressing in your blood and you enter into a phase of chronic illness. Where virus keeps on replicating in your body, and because your body has generated antibodies to fight it. So you're not symptomatic as such. So even you don't come to know whether you're carrying this virus. And this stage may last for years together, depending on your immune system, how much antibodies you have developed.
How much they can fight.
Exactly. And when our antibodies get depleted, then you start landing up in 3rd stage, which we call as AIDS.
Okay.
So this way it progresses.
So, and because it is life-threatening also, and but how much life, it depends. यानी कितने दिन की वो है. But इसमें डॉक्टर निशा एक विंडो टाइम होता है.
Exactly, sir. So जैसा हमने discuss किया, it's acute phase, which is roughly around 24 to 90 days. In this time, if you get tested for your antibodies, they will not be developed. So you might come out negative, which we usually do, the seroconversion test. But if we go for antigen test, because virus is inside your blood, if we go for antigen test, which is by the name of P24 antigen test, then only you can come to know, yes, you are in window period. So this awareness is very important. If you have been pricked with some, blood contaminated needles, syringes, or you have undergone a blood transfusion, or you know you have unprotected intercourse, then you need to consult your doctor, and they might advise you P24 antigen instead of going over to HIV test directly. Which, if
Okay.
it comes negative P24 at times, because it might be negative for certain days, 12 to 20 days. So we again repeat this test, we keep you under observation for 3 months, and then we declare you, yes, you are negative.
So the window period जो 25-26 दिन से और
Start हो गए
आपका
90 days तक
90
रहता
days
है.
तक जो होता है,
Right,
उसमें
sir.
भी if you go for antigen test
Antigen test, yes.
में एंटीबॉडीज आपकी पता लगाते हैं, तो उससे आप उस विंडो पीरियड में भी पता लगा सकते हैं, एंड यू कैन
Exactly.
प्रोटेक्ट योरसेल्फ एंड यू कैन प्रोटेक्ट अदर्स आल्सो.
That's very important, sir, because considering yourself as negative on the basis of HIV, and you are
जी.
carrying the virus in your blood, and you are a source of transmission of HIV to others also.
And here the question comes in, Dr. Nisha, that what are the sources from where this HIV comes in? What are the
So
sources of this?
that's again very important, sir, because there are lots many myths in our society, and
जी.
people get just afraid of, I have got HIV or I might get HIV. So I would like to tell there are only 3 ways to have this HIV infection in anybody's. So what are they? The most important way is a blood transfusion, which you can, for any reason you might have gone for blood transfusion. So by this technique, you can transmit, though all the bloods are being screened. But at times, if you have taken a blood in emergency, which has not been screened properly or from non-authorized center, so you
जी.
might be at risk of acquiring this infection. Then the second most common, which is in the mind of our society, is unprotected intercourse. Yes,
जी.
definitely, it is the main reason. And then the third is, which is again very important, is direct transmission, vertical transmission, or we say from mother to child transmission, which also usually happens during delivery
जी.
and later on via breastfeeding.
Mhm.
But any other secretions in our body, say like saliva, like tear, our vomiters, and sweat, these never transmit HIV.
जी.
Most of the time, we have seen WhatsApp messages circulating. Please don't drink Coca-Cola. Please don't drink this drink. This has
जी.
HIV virus. So I would like to mention this virus can survive only and only in blood. No other media can survive this virus.
So sharing water, sharing food with the infected person,
Yes, yes, you
it
cannot.
will not. It will not.
Yes, only the saliva or any of the secretions which I have mentioned, they don't carry HIV. They
जी.
will be contaminated only if they are mixed with blood. Suppose a person is having ulcers in the mouth or having gum bleed, and that saliva comes in your contact,
जी.
or that person you are doing a oral sex or you are doing a kissing.
जी.
Only in that case you can acquire the infection by this mode. Otherwise, not. Same way, as I said, sweat. So if there is some cut parts in from where patient is sweating, any secretion which is contaminated with blood, then only you can transmit the infection to others. Otherwise, no other body fluid is carrying HIV infection.
So अगर देखा जाए तो that means there are such as I was reading somewhere that 2/3 of the HIV or AIDS infected people are in African region,
Yes,
as
sir.
per WHO.
Yes, sir.
And another thing is the population which is more prone to HIV. They have also defined the prone population in this, which
Exactly.
they have sent men who have sex with men, people who inject drugs, people in prisons or other closed settings, sex workers, their clients, and transgender people. Yes, sir.
Very
So,
true, sir.
J. So these are the people who are more prone or they are more susceptible to these infections.
Again, sir, the people who smokes regularly, chain smokers, they are again at high
Okay.
risk because already their immunity level is low. The people who are chronic drinkers, again, they are at risk. See, it depends on the viral load also. If your body's immune system is that much and you have come in very minimal amount of contact of HIV virus, your body is capable to fight with this and vanish it.
J.
So it's not always that if a HIV positive blood has come in your contact, you are 100% going to get infection. It depends on your immunity level also, and the
Okay.
amount of blood which has come in contact with you
So every time the immunity is becoming important,
every time.
such as in COVID also, because it's also a virus. So the everywhere immunity is required. So
Exactly.
healthy lifestyles, healthy eating, healthy nutrition, and all this plays an important
I
role.
think we need
Jay,
to add on here, Dr. Nisha, about the dental part. If you're having some mouth ulcers or having some dental issue,
Mm-hmm.
then also they get more prone, because if they're carrying the virus and if they're having an ulcer, and if they, get a chance to connect to someone at that point of time, if there is pus in your mouth, then also you can be a carrier if you're already having the virus with you.
Yes,
So
exactly.
yeah,
This is what we discussed. Unless your secretions are mixed with blood,
absolutely.
Jay.
it's not infected. But if any of these secretion, maybe it's a vomitus, if it is a very brisk vomiting and you had injury in your this food pipe,
Yeah,
then even the blood can come in your vomitus also. Again, then this vomitus is infective.
absolutely. So
So
actually, detail, everybody should be very aware about the details about how one can get it. And if
Yes.
at all, of course, if you're a carrier or you already have been infected, तभी आपका हो सकता है. If you just have an ulcer or you just have a dental problem, may not be that you can have that problem. So,
Right.
so I think
So
detailing
let's
of, this
so
awareness
let's
needs to go to people.
yeah.
awareness is required. You have to ask for help.
Awareness
अगर
also,
थोड़ा-
sir, and I would like to say timely routine testing is also very important.
Yeah,
In Indian society, we never go for routine checkups.
Jay.
Even after so much of awareness, we find only 10 to 15% of our Indian population who comes forward for routine checkups. Because
Jay.
as I said, these when the virus goes in your body, the symptoms are, we have no specific symptoms for HIV. It is going to be very vague. So we will not even come to know. Only
Actually,
And
at a
and
routine checkup.
Jay.
it is seen in Indian society where people just want to stay in that belief कि कुछ नहीं हुआ है.
कुछ नहीं हुआ
I'm fine. कुछ नहीं हुआ है, I'm fine is like hits them, and I think that is a sign of anxiety in a different way, where they want to be okay, therefore they want to think that they are okay. Now, that is a positive affirmation.
And
Positive
Dr.
affirmation में दुनिया नहीं चलती है. So the
नहीं, but
mental world demands that we do go for those tests and face our fears. Our fears do not allow us to take tests. Even for
meanwhile,
COVID. COVID अगर
Dr.
फैल रही है इसलिए because people are afraid to go and take test and they are happy to say कि उनको कुछ नहीं हुआ. I think that is a
नहीं, डॉक्टर पिंकी, इतने सारा प्रॉब्लम्स के बाद, HIV के बारे में सुनने के बाद, डॉक्टर निशा से नाउ आई एम कमिंग टू अ पॉइंट वेयर नाउ इतनी टेंशन के बाद तो आपके साइको सोशल इशू तो हो गए, तो आप थोड़ा सा उन स्पेसिफिक इश्यूज पे अगर आप बात करें थोड़ी, that will be good for, because we are here talking about holistic health or holistic treatment, the medical as well as psychosocial, because agar dono honge to the things will be more effective. So agar if you talk about those issues, that will be good for all our participants.
So I'll now take the two things separately, psycho and social. Now in
जी,
psycho, what happens as soon as a person feels कि
जी,
उनको शायद HIV है, उन्होंने अभी टेस्ट नहीं लिया है, तो as I said, the fear starts lurking. उस fear से anybody can have anxiety. Now anxiety से भी आपकी immune system impact हो सकता है. And anyhow you are having a fear that HIV, you are having HIV, maybe the symptoms are matching. ऊपर से you are having an anxiety, it is a double attack on your immune system. And जब आपके double attack होते हैं, तो obviously now you don't know the answer. So many times one slips into depression as well, because the fear that you might not live or there is no medicine as such can also lead a person to depression. So these are kind of the psychological symptoms that can be seen when a person has HIV or thinks that the person thinks that he or she is having those symptoms or is already diagnosed as having HIV and AIDS. Now, as soon as this thought, this diagnosis comes real light to the person who's the patient, the part of how to take the next step कैसे होगा, क्या medicines होंगे, medicines ले पाएंगे कि नहीं पाएंगे, what will be the medical expenses, the finances, everything hits the person, and the person again gets into another level of anxiety and stress, which
Yes.
is again hitting the immune system. So आप देख रहे हो कि psychology बहुत बुरी तरह से किसी का भी इम्पैक्ट हो सकता है as soon as the person is diagnosed with HIV or has reached to the stage of AIDS. Now, when I come to the society, there is a social fear. इंडिया में अधिकतर ये देखा जाता है, it's really seen. I'm talking about India mostly because I have seen such cases. अगर किसी के बारे में पता होता है कि okay, this person is having HIV AIDS, उनकी पूरी फैमिली को काइंड ऑफ बॉयकॉट कर दिया जाता है. So that becomes a huge fear among the family to even go and understand the things. Whereas India is providing counseling, AIDS counseling, there are people who are, contributing devotedly to this occasion, where you can go anonymously. You don't have to even give your name, and go and get consultations, get your counseling done from these AIDS organizations, which there are government organizations as well as non-governmental organizations as well, जो ये काम हर वक्त कर रहे हैं, फ्री में कंसल्टेशंस भी दे रहे हैं. येट दे हैव द फियर कि अगर उनको किसी ने देख लिया वहां जाते हुए या निकलते हुए, that also do not allow them to reach help. So these are the social fears where it is very important for today's generation to remove this kind of a discrimination. It is after all a disease and it can be handled and dealt. एक चीज मैं यहाँ बताना चाहूंगी, whenever a person is unwell, चाहे वो हल्का सा खांसी जुकाम ही क्यों ना हो, if somebody gives care and if somebody gives kind of little bit of love, वो एक लेवल की पॉजिटिविटी में आते हैं. I can see most people here in front of me, ladies, you can well understand that when a woman falls sick, the whole house comes to a standstill, and when you get to hear a good word or we miss you, you have to recover soon and come, that itself gives us the strength. But in HIV cases, many times people feel that that person is gone for good, and uske छूने से या उसके साथ बैठने से या उसके साथ लेटने से you might have a chance of getting infected by the virus. That is how people think. Now that is very negative for the patient. वो patient उस negative thought के कारण भी एक level का anxiety and stress में जाते हैं, जिसके कारण वो ठीक होते होते भी शायद ठीक नहीं हो पाता, because psychologically the person is in not in a very good state, all because of the social kind of a pressure that the person is getting. So these are some
उसका एक रीजन मेरे ख्याल से इनिशियल एडमिट करना के somebody has got problem or the person has got problem, that's the beginning, and उस टाइम में अगर उसको सपोर्ट मिलती है.
Actually, therefore, it's an attempt from One Wellness Clinic and Rajbala Foundation to reach out and help the government and the non-government organizations in their contribution. We are also trying to give a small contribution and trying to make an awareness to all people on this day today, the International AIDS Day, so that of course we may not be able to reach everybody, but to an extent, to some people, बूंद बूंद से सागर बनते हैं. तो maybe few people who has joined us today say can get it to other some more people, and this way a chain connection is formed and some information reaches people, and we are able to finally take the resolution of a no AIDS day, that a day will come when there will be no AIDS patients. Or
so awareness hona is a quite important aspect of this.
Most important before बीमारी से पहले बीमार मर जाते हैं, मतलब बीमारी से पहले जो बीमार होते हैं वो he is already half dead. Yes, कई लोगों को the doctors coat syndrome, that white coat syndrome बोलते हैं हम इसको, कि white coat देखते ही उनको पैनिक होते हैं बहुत ज़्यादा. So
कुछ और भी issues है ना.
They're scared. इंडिया में डॉक्टर, मेडिसिन, साइकोलॉजी, मेंटल हेल्थ, से एक घबराहट है जिससे उभरना हमारे लिए बहुत जरूरी है, इफ यू वांट टू हैव अ नेशन हु इज एब्सोल्युटली हेल्दी बाय माइंड एंड बाय फिजिकल
जी,
हेल्थ।
जी। तो डॉक्टर निशा, दो तीन क्वेश्चंस हमारे पास, दो क्वेश्चंस आए हैं। डॉक्टर निशा,
हाँ जी सर।
दो क्वेश्चंस हमारे पास, आपने चैट पे तो जवाब दिया है उसका, बट एक तो हमारे साथ बहुत सारे लोग जो जुड़े हुए हैं, उनमें लॉयनर्स क्लब के लोग भी हैं, और वहाँ पे मिस ममता अग्रवाल, उनका एक क्वेश्चन था कि जेनेटिकली ट्रांसमिटेड होती है। एक तो क्वेश्चन ये था। दूसरा, somebody हैज आस्क्ड के इसके सिम्टम्स क्या हैं। इन दोनों के साथ साथ एक डॉक्टर निशा, बिकॉज इट्स ए कंटिन्यूएशन, क्योंकि आपकी ज़्यादा ज़रूरत है, साइकोलॉजिकल उसके बाद आता है, क्योंकि पहले तो बीमारी होनी चाहिए, साइकोलॉजी उसके बाद गड़बड़ होती है। तो मैं ये पूछना चाहूँगा कि इसके सिम्टम्स और ये दोनों क्वेश्चन जो आपको बताए हैं, दूसरा उसके साथ साथ इसकी क्या ट्रीटमेंट भी है। इसकी ट्रीटमेंट है, एक तरफ तो हम लोग कह रहे हैं कि क्योरेबल नहीं है ये, दूसरी तरफ कह रहे हैं कि हम ट्रीटमेंट है। तो क्या इसकी ट्रीटमेंट है, और कहाँ पे कैसे लोग एक्सेस कर सकते हैं। मैंने कहीं पे पढ़ा है कि अब आप घर में भी बैठ के इसका टेस्ट कर सकते हैं। तो आपको जो एक डर है सोसाइटी में ये बताने का, बिकॉज टॉकिंग अबाउट सेक्स इज ए टैबू, इससे कोई आदमी उसके बारे में बात नहीं करना चाहता, कोई आदमी उसके बारे में डिस्कस नहीं करना चाहता। तो जैसे एक डेटरेंट है सोसाइटी में कि हम कैसे बताएं। और फिर उन लोगों को जो जो इस तरह की, जिस तरह के हम लोगों ने जो प्रोन है इस डिसीज के या इस इन्फेक्शन के, उनके बारे में भी बताया है, जिस तरह का लाइफ उनकी है। तो उनको ज़्यादा यानी उसके साथ नहीं देखा जाता, इज्जत के साथ, या उनको थोड़ा वो किया जाता है कि नहीं ये अच्छा नहीं है। तो इस तरह के सरकमस्टांसिस में हम लोगों को बताने में भी दिक्कत होती है, और सोशल कंस्ट्रेंट्स आ जाते हैं जिसमें नहीं बताया जाता, और इसमें जिनको इन्फेक्शन हुआ है वो सफ़र करते हैं। तो इसकी ट्रीटमेंट के बारे में कुछ बताइए डॉक्टर निशा। इसके सिम्टम्स के बारे में थोड़ा सा बताइएगा, कुछ लोग पूछ रहे हैं। और हम लोग इसके, और उसके बाद जो लोग हैं जो इससे सफ़र कर रहे हैं, कैन दे हैव ए नॉर्मल लाइफ?
Right, sir. So we'll start with first question, which we have on chat also. Can it be genetically transmitted? As I said, this is a virus which can live in blood only.
जी,
So we have previously discussed also, it can be transmitted from mother to child, but it's not because of that, it's in her genes, it's in her blood. So
तो
during pregnancy, the chances of transmission from mother to child is very low, because during pregnancy, we expect only 4% of patients have
जी,
some communication of their blood with the fetus.
ओके,
I mean, so whenever there is a breach, right?
ओके,
So it's very less. The main infection transmission happens during delivery and after delivery when you breastfeed your child, because it is transmitted in via milk also. So milk is the
मदर्स
only,
मिल्क जो है।
yeah, mother's milk. That's the only body fluid which carries this virus.
जी,
So during delivery again, because mother's blood is exposed to fetus blood, and
जी,
then they come in direct contact with each other. आप लोगों को शायद सुन के थोड़ा अजीब सा लग रहा होगा कि मदर का ब्लड ही तो बच्चे को ग्रो अप करता है। सो ऐसा कैसे हो सकता है कि माँ और बच्चे का ब्लड 9 महीने मिल नहीं रहा है।
जी,
तो होता क्या है कि माँ और बच्चे का ब्लड हमारे जो वेसल्स, हमारे जो ब्लड वेसल्स के मेम्ब्रेन्स हैं, उनसे सेपरेट रहता है। इट्स लाइक अ फिल्टर, एक तरह से छलनी की तरह है कि जो माँ का ब्लड होता है उससे सारे न्यूट्रिएंट्स और जो भी जरूरी चीजें हैं वो छलनी में से फिल्टर होके बच्चे तक जाती हैं। It's not the blood directly which
जी,
travels into the vessels of baby. It's only when कि अगर माँ का कोई blood vessel cut हो रहा है या बेबी का कोई blood vessel cut हो रहा है, then only they come in direct contact, as it happens during delivery because placenta separate होता है। तो उस
जी,
टाइम पे मदर का ब्लड बेबी के ब्लड के डायरेक्ट कांटेक्ट में आता है। So one thing is this for the first question. Second was about the symptoms. So as we discussed, HIV per se doesn't have any particular symptoms, or we can say that it is going to involve this particular organ of your body. As we found in COVID patient, the most common organ involved is the lung. But in HIV patient, there is no particular organ. Any part of your body which is much compromised compared to other body parts can start having symptoms first. Usually, जो 90% पेशेंट में देखा जाता है, फर्स्ट सिम्टम दैट इज अ रैश,
Okay.
जो हमारी स्किन पे लाल कलर के धब्बे हो जाते हैं. 90% पेशेंट में उस तरह से प्रेजेंट करता है. In 10% patients, we find flu-like symptoms like cold, cough, fever, malaise, body aches, weaknesses, these kind of symptoms. So every time when you have cold and cough, you cannot go and test yourself for HIV.
Yeah.
Now you need to understand to, retrospect yourself whether you have been any contact of unprotected needles, if you have got any prig in last 3 months, or if you have got any blood transfusion in these last 3 months, or if you have any unprotected intercourse with a person whose status you are not aware of, that he is a positive or he is negative. In that case, if you have any sort of illness, any kind of illness, whether it's a diarrhea, it's a flu, it's abdominal pain, even it's a mild fever or headache, then yes, you should go and test yourself. And then about symptoms, we have already discussed. It progresses in 3 stages. It starts with mild prodrome, the flu-like symptoms and on and off mild fever. Then in chronic phase, patients start having chronic issues like chronic diarrheas patients have, and they can have chronic headaches and lung issues, breathlessness, skin rashes which are not healing, recurrent उन लोगों को ulcers होने शुरू हो जाते हैं, recurrent vaginitis, recurrent oral thrush या herpes का infection बहुत frequently होता है. Especially ये लोग prone होते हैं pneumococcal infection के लिए जो lung को affect करता है. तो अगर इस तरह के symptoms आपको कोई भी infection recurrent आ रहा है, ये सिर्फ आपको ध्यान रखने की जरूरत है. अगर कोई भी problem आपको recurrent हो रही है, इन्फेक्शन आपको विजाइनल इन्फेक्शन बार बार हो रहा है, यूरिन इन्फेक्शन बार बार हो रहा है, चेस्ट इन्फेक्शन इज कमिंग अगेन अगेन, फीवर लो ग्रेड है पर वो कॉन्टिन्यूसली चल रहा है, और अगर आपको 2-3 कंडीशन साथ में है, इफ यू हैव बीन डायग्नोज्ड विद ट्यूबरकुलोसिस एंड अलोंग विद दिस यू आर सफरिंग फ्रॉम डायरिया और यू आर सफरिंग फ्रॉम herpes, then yes, that means your immunity is quite lower down. In that case also, you are supposed to investigate yourself for HIV infection.
And related with this, Dr. Nisha, I'm sorry, because you are talking about how it spreads and how the symptoms you are talking about, but in between we got a question, another question, which I think you are the best person to answer.
Yes,
in case of a husband and wife couple, if one of the person has got HIV or AIDS, so can they have a child?
Yeah, that's a very relevant question. In fact, I wanted to bring it in this forum because most of the couples in India, they're not aware how to plan pregnancy if either of the partner is positive. Because it's not always that if you are HIV positive, you will be carrying a baby who is also going to be HIV positive. We can prevent the HIV status of your child in the way we can plan your pregnancy. Suppose, I'll tell you a few ways, there are multiple ways which we discuss as per the patient history and as per the patient medical condition. But few of them I would like to elaborate. Suppose if we find a male who is positive and the female is not positive, and now they want to have their baby. So there are 2 options. If they want the child to be genetically like them only, 100% genetically like them only, then we need to have semen of her husband only. Otherwise, there is an option of donor insemination, where we can take the semen of another patient, another human being whom identity is not disclosed. There are semen banks in India from where we can get the semen as per the characteristics of her husband, and then we inseminate as per her ovulation.
If Dr. They want, Nisha, just a moment. The question was, whoever asked was, can the person conceive if the partner
Yes,
is,
yes,
yeah,
that's what I am
yes,
telling. Conception depends on two things. If they want 100% surety, then best option is to go for donor things. They can have,
but she can get pregnant from that HIV partner.
I'm coming to that only.
Yeah.
The first option was they can have a donor eggs or donor semen, whosoever is infected. But if they want 100% similar genetic individual, then what we do, if a husband is positive, in that case, we can go for the semen wash, wherein we'll remove the seminal fluid from the semen and we'll take only the sperms. And again, these are washed ones. So the chances of transmission decreases to almost 1 to 5%. Uh, Accompanying to this also, we can combine the ART to the husband before planning pregnancy. So the viral load will come to very low. And on their repeated tests, when we found that now the viral load is very less, we start monitoring the female, and we come to know that yes, today is the day when she is ovulating by doing different techniques like ultrasound or different ways of testing. So we can decrease the number of unprotected intercourse. So we have done three things. We have already removed the virus from the semen by doing the semen wash. Second, we have given the HRT to husband, so the viral count is very low. And third thing, we have limited the number of unprotected intercourses. So if we follow all these three things, the risk of transmission reduces to just 1%.
Okay. That means, Dr. Nisha, that means what I have read is ART, this
Antiretroviral therapy. This is what I was mentioning.
therapy. If the husband is having ART, and after that, because after ART, the spread is restricted.
Yes, because the viral load is very low, sir. Basically, what we give, this drug
Then
kills the virus inside your body. And also what we do, when we plan only one intercourse during the ovulation, taking all these precautions, again, we give post-exposure prophylaxis to the female, even the pre-exposure and post-exposure prophylaxis. So whatever viral load will have entered inside the female, that will be taken care by the medication.
So that means the couple has to be very careful while.
Yes, and they should consult a doctor before planning the pregnancy. In that way, they can definitely prevent transmission to the partner also and to the baby also.
So the conception is possible, subject
Yes,
to the supervision and guidance of qualified professionals.
Very true, sir. And same way, if we find that female is positive and the husband is negative, so again, what we can do in that case, it's very simple, because it's only the female partner. So there is no need of maintaining the intercourse. We can just take the semen sample of her husband and we can do the inseminations.
Okay.
And we can reduce the viral load of lady by giving the antiretroviral therapies. So in that case, it's very, very low.
Dr. Nisha, coming to this treatment part, if you can explain somewhat how it is being treated, not in a technical sense, but somewhat if you can tell our listeners.
So for the treatment part, I would like to say best place to treat is home. No doctor, nothing else. Home is the best place to get treated yourself for HIV. A beautiful home which is surrounded by your loved ones who are always there to give you emotional and physical support. Now, the most important thing for treatment is the detection, early, timely detection. जितना जल्दी आप इस प्रॉब्लम को पकड़ेंगे, उतना ही जल्दी हम आपको उतना अच्छा बेटर क्योर दे सकते हैं, because आपकी बॉडी में वायरल लोड उतना ही कम होगा. So first key point is to catch the infection at earliest. Second thing is to start your treatment timely. There are patients who know that yes, they are positive, but जैसा Dr. Pinky ने बोला, there is myth in the society, they will not be accepted socially or culturally, so they don't expose themselves or they don't approach to the doctor to start their treatment. So that's the second harm what they do with themselves. So go and start your treatment timely. The treatment comes in the oral drugs form. There are no injections. Tablet forms, there are different medications. Usually we prefer to start treatment with combination of two drugs. For these treatment, it's not necessarily that you go and visit your doctor frequently. These days, NACO, National AIDS Corporation of Organization of India. They are doing a lot of work for AIDS, and they have your contact numbers and they deliver your medicine at doorsteps.
Mhm.
With this treatment, you need to get your certain tests done, which your doctor will advise time to time. Usually, we prefer a 3-month interval. There are few tests which we keep on seeing whether you are developing any toxicity of the drugs or any side effects or any untoward effects of the drug. So for that also, you need to be in touch with your doctor. Then the third most important thing is that patient has to understand their health as the most important priority, and they need to work on their diet, on their exercise, on their rest, and not to indulge in any sort of habits like tobacco smoking or chronic drug abusers or pricking themselves regularly.
Mhm.
And yes, we cannot forget Dr. Pinky. She has a great role. So the most important is to maintain the mental health, for which you can visit. There are so many NGOs, there are so many government organizations, there are
Yeah.
so many private practitioners who are available to help you out. Go and discuss with them whatever problem you are facing, social unacceptability, family unacceptability,
Yeah.
interpersonal relationships. Yes, they do come up, and please take their help. As
Yeah.
much as possible, try to be in the company of people who really love you. It's not just the superficial thing, who are in direct contact with you, who really care for you. Try to be with them. And
Mhm.
the last important thing is you can be in touch with the HIV supporters. There are
Yeah.
different groups where
Yeah.
they have made associations of people who are HIV positive. So they give boost up to each other by sharing their stories or by giving their examples or sharing their difficulties, what they're facing. So it's always good to to share their feelings with each other and to help
Yeah.
them cope up out with each other. So these are the few things, and the most important from medical side is the vaccination. As I said, there are few infections which are very prone when our immunity is lower down. So you
Mhm.
need to vaccinate. It depends on your age and your medical history, like pneumococcal vaccine, meningitis vaccine, flu vaccine, then cancer prevention vaccines for cervical cancer. Then we can give vaccine for repeated shingles also. This is also available. Hepatitis A and hepatitis B vaccination is also important for these patients. But we keep on telling for which patient which vaccine is important. There are few
Yes.
vaccine which we give in youngsters also. There are few which we start in even 6 months old child also. But yes, there are few which we give to prefer in old age people only, who are more than 50s. So your doctor will keep on telling you, and please go for routine follow-ups. Don't miss your visits. Get yourself tested, and
Yeah.
I'm sure you can live absolutely healthy life as your other partner or as your other family member is living.
Very assuring, actually. Dr. Nisha, Dr. Pinky, would you like to come in and talk about the quality of life after this disease? If somebody gets this disease or virus, so would you like to talk about the quality, how the quality of life can be maintained? Although Dr. Nisha has touched upon certain areas, but would you like to come in and talk about the quality of life of these people?
First of all, whenever a person has any kind of disease, HIV is quite a big name, but
Hmm.
whenever a person has any kind of disease, life, it's like a life-changing event in the life of anyone. Immediately, life goes for a change.
Yeah.
Everything in the person's life goes for a change. And that is the actual time when we have to work on the quality of the life of that individual. उस
Yeah.
वक्त आपको हर वो चीज़ वैल्यूएबल चीज़ आपके लिए जो भी इम्पोर्टेंट है इट स्टार्ट्स गेटिंग मोर वैल्यूड the
Yeah.
quality of the life changes, and all people who's playing an active role in the patient's life needs to give that kind of a positive support, a positive regard, many times an unconditional regard to those patients, and not just look at kyun hua, how did it happen, कुछ किया होगा, instead of thinking only on why the person has got it, we have to just give that person that kind of a feeling that it's okay and we can still work on it. That assurance is the quality that we need to provide in the life of the patient, instead of just thinking about what is the cause. And as you had said, Satish ji, that it is absolutely a medical problem, but nonetheless, anxiety is such a kind of problem which immediately impacts your immunity, and you get prone to a lot of medical problems. So here I would really like to make people aware that our mind and our body is connected, and it is very important to have a healthy mind so that we can maintain a healthy body. So we all have to understand this link between the mind and the body. If anybody is having any kind of mental issues, symptoms, you need to visit experts to get it worked upon. In US and in UK, all these places, they say that if you can get yourself treated in a lesser amount, why do you wait for the amount to increase? At those places, they even try to find them that when you could have got yourself treated in few dollars, you waited for more. That means जो चीज आपकी ₹1, ₹2, ₹5 में ठीक हो सकता है, आपको ₹100 का इंतजार करने की जरूरत नहीं है. So you have to be very careful in maintaining good health in all regards. Always understand what is good. Take the right option in life. Everywhere as humans we get options in front of us. It is our choice what we are doing. As an aware individual, you know where and how you land in whichever place, whether it is having sex with a partner, or whether it is going for some foreplay, or you are going for some injection. Mostly the drug addicts who are using injections, you all have got that option in your life. Now, if you have a healthy mind, you will be able to take the better option in your life, which may help you to live a healthy life rather than getting into these kind of long treatment procedures, which does kind of strain your mind and body. So preventive is very important. So healthy lifestyle, I would rather say, is a quality that we have to maintain in our lives. All of us, we have to maintain. We never know. So the more we maintain a quality life, eating healthy, doing our healthy regimes, it will help us to be out of many diseases, not only HIV, but a lot of things. That's what I would like to say.
Okay. हमारा काफ़ी आपने डॉक्टर पिंकी गोस्वामी एंड डॉक्टर निशा अग्रवाल काफ़ी इन्फॉर्मेशन हमारे सुनने वालों को, हमारे जितने भी लिसनर्स हैं और जो हमारे साथ जुड़े हुए हैं, उनको बहुत सारी इन्फॉर्मेशन दी है आप लोगों ने. मुझे लगता है कि ये काफ़ी इम्पोर्टेंट और काफ़ी यूज़फुल होनी चाहिए उनके लिए. मैं यहाँ पे क्योंकि हमारा टाइम भी ख़त्म होने वाला है, मैं ये सिर्फ ये कहना चाहूँगा यहाँ पे कि अब 100 साल के करीब हो गए हैं. जैसे डॉक्टर निशा ने बताया कि 1920 में ये शुरू हुआ था चिंपैंजी से. तो इन 100 साल पे बहुत सारी प्रोग्रेस हुई है, बहुत सारा मेडिकल डेवलपमेंट हुआ है, बहुत सारी दवाइयाँ बनी हैं और इस वायरस को कम करने के लिए, रोकने के लिए, ख़त्म करने के लिए, और कंटिन्यूसली बहुत सारी जगह पे इस पे काम भी हो रहा है. तो देयर आर सो मेनी methods available, medicines are available जो इसको रोकने में और इसको आप ट्रांसमिट ना करें किसी और को, उसको करने में हैं. तो अपनी जो मेडिकल हेल्प, आपको अगर ये प्रॉब्लम किसी वजह से हो गई है, इट इज़ नॉट नेसेसरी कि आजकल आपने देखा होगा कि हम ब्लेड से एक दूसरे का यूज़ नहीं करते हैं, हम जो आपकी नेडल्स हैं वो भी यूज़ नहीं होती हैं. बहुत सारी प्रिकॉशंस वी आर ऑलरेडी टेकिंग. लेकिन अगर किसी वजह से हो जाता है तो उसको छुपाइए नहीं, उसको बताना बहुत ज़रूरी है. मेडिकल डॉक्टर्स के पास जाइए और हेल्प अवेलेबल है, उसको रोकने की कोशिश कीजिए. और दूसरा जो सपोर्ट ग्रुप है, सपोर्ट ग्रुप मतलब फैमिलीज़ हैं या और लोग हैं, उनकी हेल्प लीजिए और इसको रोकने की कोशिश करिए. और इसको बढ़ने मत दीजिए। तो आज वर्ल्ड एड्स डे पे हम लोग राजबाला फाउंडेशन की तरफ से डॉक्टर निशा अग्रवाल, डॉक्टर पिंकी गोस्वामी, फर्स्ट वेलनेस क्लिनिक और डॉक्टर निशा अग्रवाल, उनका जो अवनी क्लिनिक, उनका अपना हॉस्पिटल है, उन सब की तरफ से जितने भी लोग हमारे सुनने वाले हैं और जो हमारा ये प्रोग्राम सुनेंगे, उन सबको ये कहना चाहेंगे कि ट्रीटमेंट्स आर अवेलेबल, इसकी रोकथाम है। तो अगर कभी भी आपको इस तरह की कोई ज़रूरत है, इस तरह की हेल्प चाहिए, हेल्प मांगिए और उसको वो आपको मिल जाएगी।
सतीश जी,
तो
यहाँ पे मुझे एक चैट में मिला है, आई
ममता जी,
वेलकम ऑल द
हाँ जी,
लायनेसेस हु हैव जॉइंड अस टुडे।
अगर
एंड
वो कुछ कहना चाहें तो
हाँ,
डॉक्टर ममता
आपकी तरफ
अग्रवाल को।
से अगर यस लायनेसेस की तरफ से आपको किसी को भी कुछ कहना हो तो आप प्लीज आप अपने माइक को अनम्यूट करके कह सकते हो। एंड वी आर वेरी हैप्पी टू हैव यू ऑल हियर, एंड इट्स अ ग्रेट थिंग दैट यू ऑल हैव जस्ट रोट इन द चैट दैट आप वेरी एक्टिवली इन्वॉल्व होना चाहते हो। wherever we get an opportunity, we will definitely keep you people in mind. You can
तो
connect
ममता
to
जी,
us. Yes, please,
ममता जी
if anybody wants
जी,
to speak on it.
Yeah, thank you, Satish ji and your team. मैं ये बताना चाहती हूँ कि आई एम वेरी प्राउड ऑफ माई लायनेसेस। आज का आपका ये वेबिनार बहुत अच्छा था, वेरी इंफॉर्मेटिव और बहुत टाइमली था। हमारी आज 14 मेंबर्स हमारे ज्वाइन किए हुए हैं इसमें, और आप लोग को बताऊं कि हमारे कुछ मेंबर्स चंडीगढ़ से हैं, जैसे इंदु मेहता जी हैं, कमला मिर्चंदानी है, और इलमपुरी जी अंबाला से हैं, कुछ फैजाबाद यूपी से भी हैं एक मेंबर शायद। तो इतनी दूर से आपको ज्वाइन करा हुआ है, और मैं उन सब के बिहाफ पे आप लोग से ये कहना चाहती हूँ कि वी वुड लाइक टू ज्वाइन योर अवेयरनेस प्रोग्राम्स इफ यू वांट एक्टिवली। सतीश जी जानते हैं बहुत अच्छी से कि हम लोग इस सब कामों में कितने एक्टिव हैं, वो पहले भी हमारे साथ जुड़े रहे हैं। मैं भी राजबाला फाउंडेशन से जुड़ी हुई हूँ, तो मैं ये चाहती हूँ कि हम लोग इसको मिल के अवेयरनेस प्रोग्राम डिफरेंट एरियाज में जरूर करें। तो आप इसकी स्कीम हमें बताइए, वी विल ज्वाइन विथ योर।
जी, थैंक यू ममता जी, थैंक यू वेरी मच। और आपके जितने भी पार्टिसिपेंट्स हैं, लॉयनर्स को मेरी तरफ से और हमारी सबकी तरफ से बहुत बहुत धन्यवाद हमारे प्रोग्राम में आने के लिए। हम लोग इसके बारे में और प्रोग्राम करेंगे तो जरूर हम लोग लॉयनर्स क्लब को बताएंगे। थैंक यू ममता जी।
May I say something, sir?
जी बताइए।
To Rajbala Foundation
Mamta
and
ji,
Wellness
for
team,
coming forward.
thank you very much. बहुत अच्छा लगा आपको सुन के, हमें बहुत सी नई बातों का पता चला। थैंक यू वेरी मच, सो नाइस ऑफ यू। आगे से हम आपके प्रोग्राम अटेंड करते रहेंगे।
थैंक यू जी, थैंक यू वेरी मच। जी डॉक्टर निशा, आप कुछ कहना चाह रहे थे?
जी सर, जाने से पहले मैं एक बहुत ही इम्पोर्टेंट चीज सब लोगों को बताना चाहती हूँ, और जिस तरह से लोग खुद से आगे आ रहे हैं टू सर्व द ह्यूमैनिटी, there is one option which we can really work for HIV patient, which is not happening in India. So any organization, I would love to come up with this concept and start doing. अभी हम लोगों ने टच नहीं किया about the mother and child transmission. तो जैसा मैंने बताया था कि the transmission from mother to child happens during delivery and during breastfeeding. अब ये जो ब्रेस्ट फीडिंग वाला इशू है, ये ऑल ओवर द वर्ल्ड बहुत ही डिफरेंट तरह से लिया जा रहा है। लाइक इन डेवलप्ड कंट्रीज इन यूएस, दिस इज कंप्लीटली बैंड। अब HIV पॉजिटिव मदर डज नॉट फीड हर चाइल्ड बिकॉज दे हैव फैसिलिटी ऑफ फॉर्मूला फीड and they are financially capable of affording this. But in resource poor countries like Africa and India, it has been made mandatory for a HIV positive female to breastfeed her child, because if we compare the antibodies amount which a mother's will transmit to the baby vis-a-vis the risk of transmission, so they say in India we have to continue the breastfeeding. So what the option left with us is the milk banking, which is happening in developed countries. So what they do, the females who are not HIV positive, they are healthy females, there are organizations who make pooling of these milk, and they pasteurize them, and they provide this milk to the HIV positive.
HIV.
Yes, so they get the advantage of breast milk, and they are not at risk of combating HIV infection from the mother. So I would like if more and more Indians come up with this concept, and we also can provide good immunity with our children without providing the risk of HIV infection.
But for this, we have to know what is the process of this milk, iski banking ka kya?
Yes, there are guidelines, clear guidelines. You need to go on hiv.org. You will get all the guidelines, or you can visit to the NACO website and you can get in touch with them. They will help you out, because NACO is always there to support any project on this.
Okay, thank you very much.
Right.
So now our program comes to an end, and thank you, Dr. Nisha. Thank you, Dr. Pinky Goswami.
Thank you so
you
much,
very much
sir.
for
It was our pleasure. It's always gives me immense pleasure to participate in any of your activities where I find people who are, all of them are very
we
actively
are
waiting to
privileged.
participate. Yes, we are
Dr.
really
Nisha, we are privileged.
very true, sir. So thank you
Thank you
so
very
much of this meeting. We need to understand that mind is basically the powerhouse or control system of our body. So if you can control your mind, you have total control of your body. So try to maintain your mental health as good as possible. Your physical health will 90% be sorted out.
Thank you very much to all those who have joined us. And thank you to Dr. Pinky Goswami again for taking this initiative. That's her initiative. She started talking about it and then we organized this. Thank you very much to all of you.
Thank you very much.